I think Dr. Amit has requested to speak fourth. So if that's okay with the other chairs, I guess it can be allowed before we delve on to the next three topics related to COVID. Dr. Madhuvanti, may I welcome you to say a few words on this webinar?
I think Dr. Madhavanth is just logging in. Maybe
see.
Dr.
Okay.
Deepani could
Yes, ma'am. Hi, Dr.
say a few words
Deepani.
instead.
Okay, I guess they are all just logging in. There must
Just
be
logging in, yes.
certain concerns. So let us then start off with the talks as Dr. Dipani, and Dr. Madhuvanti are logging in. Dr. Amila, would you like to take on your talk first?
Yeah,
So
I can go ahead.
Of time we can go ahead. Yeah, absolutely.
Yes, thank you very much. So I'm just going to start now, and I'm going to share my screen. Can everyone see my screen?
Yes, you
yes.
are.
I'm just going to try. I'm going to just change my slide. Did you see the change in slide as well?
Yes.
Yeah. Fine. So thank you very much to everyone involved in organizing this. This is a great conference for having us and the College of Ophthalmologists involved as well. And I thought since, when I was asked what to talk about, since the talk has been about pandemic for the last 2 years, why not join in? But with a different type of a pandemic is what I thought I'll talk about today. So we're going to talk about the pandemic we all know about, myopia. Now, people may argue that, yes, it's not really a true pandemic. The WHO defines a pandemic as a disease entity that affects many countries across many continents. It's not necessarily infectious, but myopia is definitely a pandemic. Now we know that the prevalence at the moment, the estimates are about 28% of of our entire human population has got some degree of myopia. It ranges from maybe even less than 10% from the continent of Africa to even more than 80% in certain parts of the Far East. So when you convert this number into figures, we see 2 billion myopes. That's the current number that we are talking about. And if you want to convert, compare this to COVID, we've still had about less than 500 million positive COVID diagnoses to date in this pandemic. The bigger problem is that the 700 million untreated myopes, they are, in addition to the ophthalmology and the individual, but there's also a loss of productivity amounting to close to maybe 250 billion US dollars. Now, that's not all. This chart shows us that by 2050, we are going to have approximately half our population myopic. That's 5 billion people, which pretty much means that, in 2050, if you can see things clearly at a distance, you are in the minority and there's something wrong with you because the majority can't, right? So it's going in that direction. So why does this really worry us? Because the problem is not the myopia itself, but the associated percentage of high myopes who will result when the numbers of myopes increase as well. And then in addition to that, you have pathological myopia, which is anywhere about 3% of the total population and already one of the leading causes of legal blindness in many developed countries, will be a big problem. So we all know that retinal detachments, myopic macular degeneration, CNVs, glaucoma, amblyopia, and early onset cataracts are all problems associated with high myopia and beyond. So this is, my argument as to why we need to take this pandemic very, very seriously. Now, the causes we know are multifactorial. They are the genetic theories. We've got, if a parent or both parents have got myopia, you've got a 2 to 4-fold chance increase for the child to be myopic. There was a thought about race, but that's not as definite as we thought it was. The other problem is with the number of myopes increasing, the myopia gene pool is increasing too. Now, the environment is something that we can do something about. We can't change our genes or our parents. Environment is something we can do about. And we know that the theories have been, is it increased near work with all the studies, the reading and indoor activities and screens our children are on nowadays? or is it less outdoor time, or could it be a bit of both? And we know that urbanization and now in the last 2 years, the COVID pandemic have contributed immensely to both these areas. We've also got ocular causes. We've got, now we know of this theory called hyperopic peripheral defocus. When you even treat the myopes, this happens. Weakened accommodation, all can be the contribution cause of this myopia epidemic or pandemic happening. So just a quick thing about quick slide about peripheral defocus. I'm really not going to go into all the details of the other mechanisms. This is when, when we correct myopia, the central retina gets a clear image, but this causes a hyperopic defocus in the mid peripheries, and this leads to posterior scleral remodeling, choroidal thinning, and the eye becoming lengthened. And this is the basis of a lot of our treatment, at least optical treatment, that we are going to speak about shortly. Now, managing myopia, I think the first thing is that increasing awareness. It's quite. I'm always amazed by how many people in the medical fraternity itself, outside ophthalmology, are really not aware as much about. I mean, you've got lots of in Sri Lanka, at least, you've got lots of doctors and their children. They've been pushed into studying and doing a lot of indoor work, academic work. And a lot of these children are ending up being myopic. So we need to screen patients to prevent or delay the onset, and also provide optical correction for healthy development. And we've got to also focus on myopia progression. And you've got to remember that the risk factors I spoke about, environment, indoor time, screen time, near work, I don't see this getting any less. It's only going to get more as technology and our lifestyle changes. Outdoor time is, I think, something freely available to us. Unfortunately, doesn't really have much commercial benefit to the industry. So as a result, sometimes overlooked in some of the studies. But we know that a lot of the studies telling us that outdoor time with UV light may release possibly dopamine, inhibiting axial elongation and stabilizing the sclera. And we know that it's not only does it slow down it doesn't prevent the incidence or the onset, but it also is effective in slowing down progression. And we know these studies from a while ago. We've known this information that when near work, there was a lot of advocates talking about near work being the cause, but we see here the Sydney myopia study telling us that near work in Singapore and Sydney was about the same, but the outdoor work was much more in Sydney, and as a result, a lower prevalence of myopia by the age of 6. So we know it's more than the near work, it's the lack of outdoor work that causes it. And again, here we know that time outdoors, if you spend enough time outdoors, that can, to a certain extent, neutralize a lot of the near work you do. And this is something I've asked a lot of my patients more recently during the pandemic to do is, take all their digital education, their screen, their studies, set it up outdoors, even in a bit of a shady area where there's a bit more luminance and bit more sunlight available. And we know that it's not even physical activities or sports. Again, Sydney myopia study tells us that it's the indoor sport had really little protective effect. It was, again, total time outdoors was the most important factor. We've all heard about the atropine drops, and it works. It works either by blocking accommodation, and you've got your non-accommodative pathways as well. Again, there have been a lot of debate and studies telling us what exact strength, and we found that the 0.01% atropine proved to be as effective, causing less rebound and less side effects, and that's being used and recommended if there is progression for maybe, or I would use it for more than, if it's more than -1 diopter. We've got myopia control spectacle lenses also. Generally, all different types of lenses work on the peripheral defocus. You've got zones or individual islets, like you can see down here with the Essilor, the newer lens here, or you've got a clear zone in the center for central vision, and then you've got the defocusing zone to counteract the hyperopic defocus, causing a bit of myopic defocus and inhibiting growth. You've also got the Myolux lens from Essilor again, which causes a bit of less strain on our near vision when being used while having distance unchanged. So you've got these options. Contact lenses available to us as well, and they pretty much work on the same principle as the spectacle lenses do. having different zones for correction and different zones for treating to eliminate peripheral defocus. Orthokeratology is something that can be looked at overnight. Rigid gas permeable lenses for low to moderate myopia. It remodels the corneal surface into a transient, flatter, or less powerful surface and causes less peripheral hyperopic defocus. And this shows that the recent studies have been showing that it reduces axial elongation by about 50%. But again, you've got to keep in mind the risk of microbial keratitis in keeping a lens overnight in a child's eye. So look, I mean, the take-home message is that I think as lots of people are addressing and realizing in the ophthalmology community that myopia is a pandemic, and it's not one of these pandemics like we've got COVID, where we expect it to sort of die off, vaccines treat. Once you become myopic, you're going to be myopic for a long, long time. And I think it's got great costs to the individual and overall to a nation as well. And the important thing and the good thing is that it's largely preventable, but we need to increase awareness amongst not only ophthalmology community, but medical and the public as well. And I don't think no longer India and Sri Lanka are exempt. We were always thinking 5, but now we see in Sri Lanka too, we are getting high rates there. And we've got to try to neutralize the risk factors. And we've known that, I mean, it is possible, and we've got to try our best to go in that direction. Thank you very much for your time and attention. Thank you.